treatment side of things, some of you probably already have heard in the news positive results of dexamethasone, which is a very old generic steroid, which has been used for many, many decades, has a very good safety profile. So what I want to show you is the study that was published as a large randomized trial in UK at Oxford University. If this one ends up being fake news, I don't know what to say, but I doubt. I think this is real. So they took a lot of patients, and in the group that received 6 milligrams of dexamethasone, they saw a 30% decreased mortality in the severe group, which required intubation, and 20% in the patients who just received oxygen. So this is very good. That's probably the best result we have. It's a lot better than remdesivir. So I'm pretty sure that as soon as this gets published, most of the academic centers, probably all the clinics, are going to start using it. What's kind of interesting that there were a lot of loud voices early in pandemic that were saying that likely steroids going to be effective. Then there was a lot of voices critiquing those voices, and lo and behold, we have. Okay. So the second news are not so great, and they're basically a highlight of the fact that we're not out of the woods. So this is the actually the map that I lately like the most compared to some others. So this is the statistics of last 2 weeks. So roughly since the holiday, since the Memorial Day. And you can see that in a lot of states, there's a lot of spiking. So what you're seeing is red, yellow is an increase. And if I click, let's pick, I don't know, what do you want to pick? Florida? Of course, Florida. Okay, so you can, here's a one county in Florida, so you can see that they have a pretty substantial increase in an average 7-day cases reported in terms of uptick, so it's quite significant, versus good news for us. Where are we here? So we are, right, Prince George's, so DC, where's DC? Here. So we are on a continuous nice trend down. We're halved where we were 2 weeks ago. So I don't think that's necessarily a cause for us to sort of loosen up precautions. I think that doesn't change at all. It also clearly points to the fact that virus is still here. There's no such thing as a second wave. We still haven't gotten over the first one. And this is the states where expected temperature is a lot higher. So unfortunately, right now, we don't have any hint that things are slowing down because of high temperatures. So I'm going to stop sharing this, and I'm going to put the links in the, once I finish, I'll put the, actually, let me put the links now. So this link is a New York Times. Let's see, and then I'll put the other link. And the other link is actually from the Oxford University, from their own primary page. There's a lot of discussions of that article all over. I recommend that if you want to read it in original, read actual report from the university where the study has been done. Okay, and so to quickly summarize the podcast that Dr. Liz Alschluer just did with us, with Janet and I. The Andrew Weil Center for Integrative Medicine at the University of Arizona recently published general recommendations of natural or integrative preventive methods, and they are listed over here. Thank you so much, Janet, for posting that. So you can take a look at this. And in short, there's a lot of methods that are clear at improving immune system and down-regulating inflammatory response. And Liz quite articulately spoke about a lot of the things that we already touched upon: sleep, anti-inflammatory supplements, nutrients, etc. So the sort of the basic preview there is a lot of these recommendations are actually quite evidenced. And I think the article that they've published in a peer-reviewed journal summarizes the actual evidence. So this is not to be taken lightly. This is not something that somebody just stated because they want to sell the supplements. The whole point here is there's an actual evidence that, as Dr. Frame said a couple of weeks ago, or was it last week? Now I can't remember. each your colors. Well, the point is that there's flavonoids and these colorings that give the color to the food. There are some of the key nutrients that tend to help us to regulate inflammatory, put the inflammation in a checkpoint, especially when inflammation takes off and becomes poorly controlled, as in case of the virus. And so the essential aspect here is really get a good sense of, what are you getting, what are you not getting, and what can you add. Actually, podcast is not going to help you with that. We kind of went over, briefly discussed this, but if you want to get the full recommendation, I think you'll find quite good number of important information there. I'll stop with this because I really want to give Luanne as much time as possible. I think that's actually what came out from our last session. I really liked, I so much liked Dr. Baban's part that I felt like it was way more important for us to engage in that than, not that Dr. Serre's stuff wasn't important, but practice.
Can I just do one kind of broad question for Lee? Do you think the spikes are happening because these areas did not have strict stay at home or other such public health measures?
You asking everybody, or are you asking?
No, I'm asking you. This is a question from Lee.
From Lee. Yeah, no, it's definitely because there was a laxity of the isolation, of the social distancing. I mean, I don't think there's any question about it. Florida had a little bit of an unusual situation. They rolled out more tests. There was a spike in the testing, but it doesn't explain everything. So I do think that testing, some of the states that have increased testing, probably pointing to more positive tests and thus reporting those. But I don't think that describes everything. I think there's an actual increase in true cases, and it's probably due to the fact that some of the states decided that, they can just not pay much attention to scientific recommendations of masks and social distancing. And so, unfortunately, we're seeing that. I guess we're doing okay in our area, which is good news for us. But, cautionary tale, don't ease that up. Okay, let's do a couple more questions. I don't see.
Given that, what is your view on air travel in July? Any ways to make it
less
risky?
That's a great question. So here's my take on this. This is my personal take. I don't really necessarily read something extensive about it, but that's what I will be following. I think it's okay to start doing short flights, the flights where you can wear a mask entire flight. I would, in that case, recommend wearing N95 during the flight, but in airport, you can wear a regular mask if it's difficult for you, because when you're sitting in the plane, N95 should be okay. You're not moving much, so there's no real risk of any problems with air. Airplanes supposed to filter the air, and there are HEPA filters in the planes. The problem with the planes is if you're not protected and somebody's sitting right next to you for a prolonged period of time, that's the problem. That's why if you were to travel, I would advise N95 on the plane. Some airline companies, I know for a fact JetBlue, and I think Delta, they are separating, so they're not sitting people next to each other, so they're putting between the middle row is empty. So there's a little bit of a separation, but you can imagine that's not really much. It's only like 2 feet or something. It's definitely not 6 feet for sure. But again, the plane's supposed to have some component of negative air pressure. So the concern would be if somebody next to you is sitting coughing. And my proposal is basically like this. If the travel is not essential, don't do it. If you sort of haven't seen your grandkids in forever and it's starting to impact your psyche, I think that we can try to do it that way, with N95, with no gloves, just no eating, no drinking during the flight, and that's why the issue will be the flight would be very limited in distance. So like flying from one coast to another without drinking water is really not possible, and it's going to be difficult to do. You're going to have to kind of get up, move to an area where there's nobody there to drink, take a sip of water, put the mask back on, and return to the seat. That's hard to do, and probably unrealistic to some degree, and probably just because of the time spent on that plane if you're unlucky and somebody sits next to you, the chances are much higher. So, but, you know, a lot of short flights that are an hour, 2 hours, with the caveat of the mask. And again, that has to be a 95. That's really important. The surgical mask will not protect you if there's somebody who's sick sitting right next to you at all. That's really critically important to understand. It'll protect somewhat other people if you developing symptoms by you coughing or sneezing into the mask, but it won't protect you if somebody next to you is sitting coughing. And assuming that that person will wear a mask, regardless, there's some leakage occurring. It just decreases of the spread, but it's still some. It's not zero. It's a good question. All right, I'm not answering. I'm not answering any Trump questions.
Okay, the last thing on this, because just talking about N95, what method, if any, do you trust for at-home sterilizing of N95 masks for multiple times usage?
None, because you need a professional grade autoclave to do that. I'm not aware there's anything available that could, without destroying the mask, could sterilize it. So, you know, the good news is that N95 are now available. You do want to make sure, we talked about this last week, Dr. Boban very detailed explained that you want to get the mask that, you know, correctly certified. I'm not buying up China masks from China may be a little tricky, so you want to find local sources. They're running at around $5 a piece, so you know you can use them for the flight, and then once you stop using, they are good for a while. So they're good for, you know, a day or two of continuous use, if not more. So you can simply put them back in a bag, paper bag or even plastic bag, and then just store it. I wouldn't try to clean them because you're going to probably break them by doing that.
Okay, should we move to Luanne?
Mm-hmm. Okay. Thank you, Misha and Janet and Elizabeth, and welcome everyone. I'm going to turn my screen to just look outside my window. We'll be doing 2 meditations today that are linked together. I wanted to share some other facts. Elizabeth gave a great professional background, but I wanted to just share a few other facts about me today. First of all, I'm a dancer. I've been dancing since I could walk, because dancing brings me joy and happiness. So during COVID, my dance group was able to meet via Zoom, but just this week, we got to meet at our very large ballroom studio and dance together 6 feet apart. As you know, I've been a therapist most of my life, speech therapist, working with stroke and brain injury, and then Reiki and Biofeedback Teacher. I am drawn to the study of how both people and animals communicate. This too began in childhood, but I gained traction from my time working with patients who had difficulty talking and needed to find other ways to communicate, understanding that there is a field of information and an intelligence at work that does not rely solely on words for us to connect. It was just a short hop to focus on touch as a nonverbal way of communicating. So today I invite you to explore a multidimensional meditation, including self-care touch, sensory awareness, heart breathing, guided imagery, and shamanic journeying. Calm, comforting touch signals a sense of safety and trust. Touch soothes and calms the cardiovascular stress. It activates the vagus nerve, which is intrinsically involved with our compassion response and the release of oxytocin, the hormone that creates that feeling of love and well-being. Daily, we do numerous and often unconscious self-touch mannerisms to soothe ourselves. A touch to the chin, a brow wipe, holding an elbow, rubbing our hands together, or massaging a foot. And why? Because the skin is our external nervous system. Touch is fundamental to human communication, bonding, and health. It's good for the giver as the receiver. It's our most social sense. And in this COVID environment, we are definitely being denied even our normal amount of social touch as we remain 6 feet apart. When we place hands on our own body, they become a biofeedback connector from that body part to the brain, somatosensory cortex, and the posterior insula, and back to the whole body through the endocrine and nervous system for the purpose of stress reduction, emotional balance, and enhancing our feelings of well-being. Guided imagery uses the power of our imagination to create relaxing and positive images or experiences. As Ida Rolf said, vision is touch at a distance. In light of our collective need to face our fears, the pandemic, and the unknown of what survival will look like, the prejudice, hate, and racism in our country resulting in a lack of justice and liberty for all. We are going to use all these tools today, touch, imagery, breath, and we're going to consult guidance from some of our best teachers on the planet, the trees. So our meditation today engages the tree metaphor as our guide or shaman on the journey of healing. Living in the Pacific Northwest now, I am awed daily by the majestic conifer forests growing right up to the beaches of the Pacific Ocean that stimulates dramatic visual, tactile, auditory, and olfactory sensations and emotions. I invite you to really make yourself comfortable. Find a comfortable seat, lie down if you want, close your eyes. And as you are settling in, ask yourself these 2 questions. First, what is your heart's desire? What are you longing for? Pause to consider the first thing that pops in your heart. Got it? Hold on to it. Second, if you were a tree, what kind of tree would you be? Again, pause to consider the first tree that comes to you. Now, as a tree, what is your job? What is your role as tree? You lift your limbs to the sky and feel the light of the sun, the moon, and the stars. Your leaves absorb the light and transform it to energy. You breathe out oxygen to support the planet. You grow roots deep into the earth to gather the nutrients to sustain you, and so you can reach upward with strength and power. The rain quenches your thirst. So each of us now is our own separate tree, and trees often have heartwood centers that begin to hollow out for various reasons as they grow, without weakening their core strength. Your heartwood center is soft and yielding and spacious. Start to breathe in and out with it. Seek out the dark places. For when we seek out our fears and let go of attachment, we begin our healing. Now your body becomes your tree. With your hands and your attention, move to the head. Moon and starlight flow into the top of your tree and then into your heartwood, your central channel, and fills it with the indigo light of a midnight sky. Take 5 breaths. Feel the connection and flow of this cool starlight into your hollow heartwood channel. Do you have a connection to a special star? Pause and collect. Now move your hands and your attention to the throat. Find a comfortable way of touching your throat. Wind now flows into your heartwood, your central channel, and through you. Take 5 breaths. Feel the wind flowing through you. Is it a gentle breeze or something stronger? Pause and collect. Moving your hands and your attention now to the solar plexus. This is the upper belly, below the ribs, above the navel. Sunlight shines upon and flows through you. We take 5 breaths. Feel the sun's rays shining, flowing, recharging your solar battery. Pause and collect. Hands and attention now move to the low belly. This is below the navel but above the hip bones. The element water flows through you. We take 5 breaths. Is it a waterfall or a stream? A bubbling brook or waves of the ocean? Your choice. Pause and collect. Hands and attention now move to the groins, or place your hands on your upper thighs, whichever is easier. Legs and feet. Connect and extend your roots into your magnetic Mother Earth. Five breaths. Feel grounding earth energy rising, flowing upward, greeting that which flows from above. Pause and collect. Hands and attention are now on the hips. Hips are the gateway between heaven and earth. Take 5 breaths. Your hollow heartwood is open and spacious from top to bottom, from heaven to earth. Pause and collect. Hands now move to the heart. The heart is the seat of unconditional love flowing from you to the world and back. Take 5 breaths. Who or what are you grateful for? The veil of darkness is lifted when you remember who you truly are. One spirit, one light in the world, overflowing with love. Pause and collect. The journey now continues as we trees gather together. We are our own little multidimensional forest, and we are here to support each other. We sense the approaching storm. Dark clouds are here. You smell the impending downpour of rain. You feel the sun hot above. Your roots are deep and strong into the earth below. Your branches, your arms reach out and up to float on the wind that comes, for they are fierce and flexible. You bend and flow, dancing with the wind, reaching down and up at the same time. Your spine, your trunk is stable. You do not resist, but settle into your flexibility, your unbreakable resilience. You have no fear of the storm. You welcome its cleansing wind and refreshing rains. It blows away all dust and debris and gives respite from grief and anxiety. The storm passes, and there is a peaceful and quiet calm. You are refreshed, rejuvenated, restored. You breathe relief for yourself, for your fellow trees of the forest, for all who struggle in this time. One last question as you return from this meditation. Did you receive your heart's desire? If you did, how do you know? If you didn't, how do you know? And with another deep breath, we bring our awareness back to the room, pausing to remember what you want to hold on to. Start to move fingers and toes before gently blinking your eyes open. Maybe stretch. Write any notes about your session you wish to hold on to. And with gratefulness for being together today on this special Juneteenth. Thanks.
Thank you, Luanne. This was wonderful. So I think there's maybe some questions. I don't want us to go too long, but if anybody has questions, then I'm happy to stay a little longer. There's a question about children playing in a playground. I think, first of all, children are very unlikely to get the severe significant illness. So if they have, for themselves, that's not really a concern. But for the parents, you know, obviously keeping social distance in playground, similar to when you're exercising outdoors. I personally do not wear a mask when I'm outdoors. I don't think it's necessary if I keep a significant distance away, more than 6 feet, when I'm outside walking or running or biking. Same with kids. If the kids are from same household and they're just together playing, I don't see any reason to even wear a mask. If there are any kids coming close, you can make a decision either to withdraw the kids, move them to another side of the playground, or put the mask on them.
There's some guidance questions more about how many times can you wear an N95 mask before throwing it out? I mean, using it for shopping in supermarkets, restaurants, or public settings.
It's not how many times, it's the total length of the mask. There's a lot of sort of lack of clarity. At the hospital, literally, we are told to use it until it falls apart. So if it's visibly defective, you need to throw it out. Otherwise, or if it's visibly soiled, and do not try to wash it. I'm not encouraging anybody to sterilize the mask with any kind of methods, because whatever the CDC recommending, that sterilization method is extremely unlikely to destroy the mask. So I don't think it's wise. I think it's much better to buy enough masks and simply throw them out when they're appear to be lost their integrity. So yeah, there's no easy answer to how long. I would just say I've been using same masks from the beginning, just FYI. There's one mask that I've been using that got soiled, I threw it out. Otherwise, if you carefully put it on and take it off, they're gonna last for quite some time.
So for example, spraying it with alcohol?
No, absolutely not. Do not spray them with alcohol. It doesn't do much of anything. Because remember, if the virus is trapped in the mask, it's going to die within a pretty short period of time, and it's not going to go through. Spraying mask with alcohol likely will destroy the mask after several sprays, so I wouldn't do that. Shields versus closed masks. There's a lot of discussions about it. I think there's no real clear comparison which one's better or which one's worse. One problem with the shield is very simple. You're not protecting anybody around you with the shield. You may be protecting to some degree yourself. I probably would favor the closed mask, to be honest with you. Mostly because, yeah, sure, they allow virus through, but they will catch droplets and they will catch your droplets. So.
Amtrak and air travel, same thing?
I don't know. I don't know if the Amtrak cleans the air, how they do that. But in terms of masks, absolutely. Probably easier to keep the distance in an Amtrak, I would think. I'm guessing if they're just as half-loaded as a lot of the planes, you're probably going to be easier finding space where you're quite isolated on the train. Yep.
And I guess there was an article in the Washington Post today about the effectiveness of plasma in a similar vein. What will can we talk about the news of stem cell transplants for the cytokine storm? And there's also a request for a second meditation today.
That's good. Okay, so the stem cell transplant for cytokine storm, you can forget about it. Don't read those news. It's irrelevant. Stem cell transplants are exceedingly expensive. Figuring out who your appropriate donor takes time. Just there's no point reading news that are not practically applicable to the situation. This is not an academic exercise of excellence. This specific meeting is really all about practicality, so I'm not going to address that. There was another plasma. So the plasma is in use currently. I understand that we've used it frequently at our hospital. I don't actually know what evidence is out there. So if there was something that came out today, just Ghislaine, if you don't mind, can you put the copy of the link for me to quickly take a look if we have a minute? Because I haven't seen this, so I would love to take a look and see what they're saying, or we can address it next week.
I'm wondering if Luanne, I know Janet was going to talk a little bit about Juneteenth for us, or with the group.
I can do that at the end.
Okay.
But what I wanted to do is remind everyone that if you go to AIM's YouTube channel, Luanne's previous meditations are there.
Luanne, could you lead us through maybe just a short breathing exercise? Don't mean to put you on the spot.
Oh, sure. So, my neighbor is starting to trim his bushes, and I've asked him to hold off for a few more minutes. So if you start to hear a buzz saw outside, just be patient with it. All right. So breathing is all about relaxing into your body, but not relaxing so much that you collapse. So if you can, find a seat that allows you to sit tall. The first meditation we did today, that was not necessarily needed, because what we were doing was using more of our imagination and our sense of really holding ourselves in these places. And I encourage you to continue to try to use self-care touch, because it has an automatic effect on the nervous system, no matter what you're thinking. When we capture the mind, when we hold on to our thoughts and guide it in a focused way, that helps us to let go of the anxiety that's always present there. For many of us, maybe not for all of us, but for many of us, and certainly during this time. So to breathing, we want to relax, but be erect and tall. And we want to feel that the air goes and penetrates first into the chest area. And then we want to relax through the diaphragm, that muscle under your ribs. And when we relax there, we'll notice that the belly starts to soften and pull away, becomes larger. We're always trying to hold in our tummies, but in breathing, you want to relax that. And then automatically what you notice is that your breath starts to become deeper. So we begin always with 3 to 5 breaths. That gives us a goal, and it also teaches us that we can do relaxation in a very short period of time. It doesn't have to be over a long period of time, that we can actually harness the anxiety in the nervous system and calm it, balance it through our breath. So let's try that together for a minute or two. I'm going to time us, so I'll let you know when 1 minute is up, and then we're going to do it for another. And your job is to allow the breath to flow wherever it will. So if it's only flowing into the upper chest, so be it. And just work on that next exhalation, letting go a little bit more. So every time you breathe in is an opportunity to invite in a quality in your life you would like more of. What's my heart's desire? What do I desire in my life? Peace, joy, an end to our suffering. So that in-breath is an invitation, and use it wisely for yourself. And every exhalation is an opportunity to let go. What can I let go of? Can I let go of tension? Can I let go of negative thinking or self-criticism? And the practice really is one of just inviting in and be willing to let go with that exhalation. So that was 2 minutes. Let's focus a little bit on how to exhale. When you exhale, if you feel like you've been holding on tightly because of whatever, then you can let that breath out through the mouth if that makes you feel good. Just let it out. If you find yourself getting into a rhythm with your breath, then you may not need or feel that need to really exhale through the mouth. But what is most important is for you to bring awareness to your breathing. Allow the body to soften. Invite the breath in as you would a friend. Welcome the breath. We can do open arms for the breath, and we can hug the breath close to us. And then we can let it go. The breath is our best teacher about how to let go, because as good as it is to take a breath, if we don't let go, we don't get the next breath. Let's breathe together in silence for 1 more minute. May you be healthy. May you be strong. May you be at peace. May you be free of both internal and external suffering. And that was 5 minutes. So see what you can do in 2 to 3 to 5 minutes.
Thank you so much, Luanne.
Thanks for asking.
Before we let everybody go, I just want to tell you Hana to this community. Hana is the Gullah word for welcome. My mother's side were Gullah. So as we celebrate Juneteenth in the midst of an overdue national reckoning, we honor the African lives stolen in the making of America. We honor the ancestors. We celebrate their emancipation from legal enslavement and recognize that true liberation has yet to be achieved for their children and their children's children.
Oh, no.
Please be well, be safe, find balance. Have a good weekend.
See you all next week.
Thank you so much. Beautiful. Thanks. Thank you.